The next thing we want to do is sort of look at a cause and effect. What comes before, what precedes that outcome? So is it just young children getting lots and lots of exposure to sugar, less activity, that's causing that type 2 diabetes to show up earlier in younger children within a specific population? When we look at lead, is it that those infants, as opposed to infants who live somewhere else in Michigan, are getting exposed to lead all of a sudden? Because if lead has been tested for in infants, and every infant gets this when they go for their well visits, and 10 years ago we didn't see this, but now we're noting that something is causing this change, which will have a negative impact on this population. And what that means is that we have to alter that identification of the cause is so important, because if we're going to alter or do our plan for implementation, we have to look at what that cause is and what can we do about that cause. The next thing we want to look at is, was the quality of evidence for the intervention? So lead testing is standard. It's been done for 40 years in children. Most of you had lead testing when you were an infant. I did, so it's been around for a long time. The evidence is, we can look at when this level started to occur and when it went up, and has it happened before. We can test it against other counties, other districts, to say that it is either something about Flint or is it something that happens in the whole state. Again, the quality of the evidence, the way we compare and contrast it, is very important. And the way that we collect the data and the evidence is really important too, because in the United States we have a system in place, and sometimes that is with individual health providers or individual hospitals that report to other entities. But that data collection is in place that feeds into that public health system. In the same way that one of the reasons that we see things like gun violence, and we've determined that it is a public health issue, is because it's not happening everywhere. It's happening in specific areas to specific individuals. There are specific causes for that occur in some places, not others, and it has a negative outcome. A lot of the people who are hurt by gun violence are younger, so we know that the implications and the cost is going to be a lot more further out, as opposed to if, 80-year-olds were involved in gun violence. That would be a whole different story. But this is also public health in that it's growing, but it's still contained within specific areas. Gun violence is not all over Chicago. It is in specific neighborhoods. So again, these sort of ways that we look at things, sometimes we look at things like injuries, and why we can determine they're public health issues is because of some of the things that we're talking about when we talk about the Perry approach. Again, this indicates then what kind of harms there are. Is it an immediate harm? So with lead poisoning, we know that it immediately impacts the brain. It has immediate negative impacts. With type 2 diabetes, we know that it has impacts, but they get worse over time. So we can sort of try to contain it, pull back the disease. One of the reasons why we started to pre-test people who might test positive now for pre-diabetes is because we've got a lot more tools we can do to try to make it so they don't cross over to that. Again, if we could figure out, and we sort of do know who's at risk for gun violence, then we can do some kind of intervention to make sure that we can reduce their exposure to those incidences, which will have a negative impact and outcome. So what are the implications? What implications, what interventions should we do? How should we do them? And again, the all-important who's going to pay. You can't just go, well, we'll do an intervention, because someone's going to have to pay for that. Someone's going to have to monitor that, and someone's going to have to evaluate it to see that it has a good, positive outcome. Now, as you've seen in the 3 cases when I introduced gun violence as a public health issue, those 3 things that I've talked about have happened to children. And they happen to children before they are teenagers, or when they're young teenagers, or when they're in the sort of the prime of starting to earn money with gun violence, 24-year-olds. All of those things, again, when we look at who they're impacting and they're reducing the quality of life, and they're going to start younger, that means that the implications for society are going to be bigger and wider. We're also able to sort of say, here are the things that cause it. So what can we do to reduce those causes so that we don't have these outcomes? In the case of Flint, we could very much see it was water, that it wasn't their houses. We could go into all their houses and see if it was their houses and then reduce that and say no. But we can look at the water and we measure the water right away and we say there's high lead levels in this water. So then we also know that there's probably other people, secondary people in the community, who are also negatively impacted. But the ones that are the worst impacted would be infants and small children, because their brains are still developing, and because the worst impacts that they have immediate impacts, and they will have an impact for 20 to 30 years, as opposed to if And unfortunately, this happened. If someone who's 80 years old gets lead poisoning in their water, the impact and the implications for their life are further out. One of the things you have to do is, when will the implementation occur? So in Flint, we could have changed the water supply, and what they did was they brought in alternative water. This problem is ongoing. It hasn't changed that much, but it has reduced the incidence. We also think at who should be implementing this. So should it be the state, federal, or local governments? And this was one of the issues in Flint. Who's going to clean up the water? Who's going to pay for it? Because it's the pipes, and it's the reversal of a system they did. So they did one implementation of changing the water, which they were doing to save money on a under-resourced population. Please remember these things, because again, like I said in the previous video, and I will talk about almost every week, access to resources, who gets impacted, all of these things determine who is going to pay and how those outcomes are going to be measured. We also should look at who's going to implement those, and are those state, federal, and local people. They could be a combination of all, but we also still want to keep up that who's also going to measure it. Sometimes the people who are implementing it are not the people you necessarily want to measure, because if your job depends on if you do a good job, you might not be measuring it the correct way. And here again is where we might be circling back to the initial people who alerted us to the cases. So one of the ways to evaluate it would be for the same doctor, pediatricians, to see, is there a reduction in the lead levels in children coming into Flint, Michigan. We could also have people testing the water. Again, not the same people who are doing the intervention possibly, but other entities that are measuring it. And that whole feedback loop is going around to help us continuously improve it. It's also alerting us to what we're not doing right, what we are doing right. Again, someone has to pay for this, and sometimes the people paying for it are not necessarily people measuring the implementation for good reason, because we want to hold their feet to the fire. We want accountability. In public health, you want accountability. You want to see if something's working, and if it's not, you want to do another kind of intervention to make it work, because as you've seen in all three of these cases I've pointed out, and so many more that I am going to point out, it isn't as if someone just loses a car or a house or loses something. They lose their health, and in some cases, when you lose certain parts of your health, you are not going to get it back. So these young children who have got lead damage to their brains are going to have developmental disabilities and educational disabilities and capacities reduced for the rest of their lives. And these are infants. There was nothing they could do to prevent this themselves. It wasn't like they went, oh, I'm going to drink this bad water. So the implications and the responsibility and the outcomes are even more important than if something happened to someone who was older or to someone who had a choice. This is some of the things we're going to talk about when people choose not to do things that will reduce their risk. But again, in all three of these cases, most of these people are children who are involved in gun violence. They're children who have type 2 diabetes at a very young age that we're seeing in a specific population. And they are infants. So again, we need to make sure that the intervention works. We need to change the intervention, and we need to make sure that we either reduce or do away with all of these, so that these individuals, despite where they're born, have the same outcomes and the same opportunities at life as other people born in other places.